All right, I see people jumping in. I think we're in the waiting room. We're going to give people just a second or two to be able to join us. For everyone that's popping in right now, we are so grateful that you would take time on a Thursday evening to be able to gather with Jim Denison, with Dad and myself as well, to be able to share some insights and learn some insights, Dad, from you about where this virus is headed even in the last week. And be able to, even in the midst of being physically distant, even be a little bit socially and spiritually close as we lean into what God's speaking to us in these times and get to hear from one another and be, even if it's virtual, around the same kind of virtual table together. So give everyone just a second to keep popping in there, and we'll get started with the full presentation in just a moment. All right, perfect. I'm seeing that number get up. So I think what we're expecting. So let me stop the share and we'll get going on the normal presentation. Dad, hey, thanks for being here again. I know we weren't expecting when we did the call last time around to gather back up and within a week, but we had so many questions last time around that we weren't able to get to. And so I know we had a phone call right after and had a great conversation about what it would look like to even do this within another week, to just be able to glean some insights from you and hear where this thing is heading and have you help us kind of stay ahead of the curve on this, as well as be able to be encouraged by what God is doing in the midst of the season. So thanks for making the time and the space, Dad, to be here for us.
I'm delighted to do this. As you know, Craig, as you know, everything we do depends on the donors that are on this call right now. And one of the things we're constantly looking for is ways that we can add value, ways that we can be helpful, ways that we can encourage. And that's not just because we're grateful for the donors that make this ministry possible. Our whole call is to equip Christians to use their influence more effectively for the kingdom, to help them to be able to use the resources God's entrusted to them and be able to use their relationships, to be able to use the leadership God's given them, and to be able to make the impact that God's calling them to make. So if we can have these kind of conversations with people that have such enormous cultural influence and significance, it's really missional for us to do this. So it's really on both levels, isn't it? First of all, we're just incredibly beyond words grateful to those on this call that make this possible. We have no other source of income except our donors that just provide for us in a way that allows us to do this. But also, if we can help you, if we can help you on any level, personally or spiritually, if we can help you culturally, then that's what we're called to do. And delighted to be in the partnership with you today.
I want to reiterate that for those that are here and for those that will watch this after, how grateful we are to be able to partner with you in this season. It's an unprecedented challenge that we've been experiencing, all of us as a people. And at the same time, in the midst of that great challenge, we're experiencing across all of our platforms, across all of our brands, Denison Forum, First 15, Christian Parenting, everything that we do and that you help us do. We're experiencing an unprecedented openness and leaning into the gospel, and unprecedented openness and interest in who God is and when he's speaking in the midst of this season. And even in the midst of things like podcasts, engagement, really as rhythms have stopped where people listen to podcasts and things really have taken a massive dip across the world. We've seen things like the Denison Forum podcast triple its reach in March alone, just as people are looking for the resources the Denison Forum provides. And it's your partnership with us financially that empowers us to be able to proclaim who Jesus is and who God is and how good he is in the midst of these trying times. And so thank you for your partnership for those of you that are here today and that will watch it after. And thanks for being here with us and making time to be with us here today. A couple quick host things for us to cover. We're here in Zoom. Thanks for making use of this technology. The way we'll do Q&A today is a button that you should see that says Q&A. Inside of that, you can post questions either under your name or anonymously, whichever you would prefer. And what we'll do, Dad's going to have a short time of presentation for us. A ton has happened in the last week. And so I'm excited for Dad to kind of get us up to speed week to week and kind of reference where this thing is going and what God's doing in the midst of it. And so Dad will kind of get us up to speed in about 10 minutes or so. And in the midst of doing that, we would love if you would go ahead and start posting questions there. If you have questions now, feel free to go in that Q&A tool, post questions there and be able to anonymously under your name, and I'll be monitoring those. And what we'll do is when Dad is done with his presentation, we'll shift into the majority of the time. That will be simply just answering whatever questions you might have so that we can help Dad be an asset and a resource. It's just an example of how we are really here for you in this season. And so Dad, thanks again for making space to do that. Use that Q&A tool. There's a lot of other ways you can do things. That's what we'll be monitoring, is the Q&A tool if you have questions. For those of you that might be here that are a First 15 or Christian Parenting reader or listener, might not be familiar with who Dad is, with who Jim Denison is. Dad is the founder of the organization, the co-founder of the organization, as well as the founder of the Denison Forum, which resources more than 1.7 million people a month across email and web, and across their podcasts and all the other places across social platforms, really helping people understand what God's up to at the intersection of faith and culture, and ultimately mobilizing a movement of culture-changing Christians. Dad is also the resident scholar for ethics for Baylor Scott White Health, and has a really unique perspective on where this virus is going as he gets access into some of the things that are happening inside of the medical space. And so I personally glean, as I've my whole life really appreciated getting to get access to Dad's wealth of information and wisdom and insight and knowledge. And so I'm excited for everyone else to get access to that as well. If you're not sure who I am, maybe you're just a Denison Forum reader or listener, my name is Craig Denison. Alongside Dad, I help lead Denison Ministries and have a brand called First 15 that's helping people start their first 15 minutes every day in God's presence with worship and reading and prayer. We also resource a little over 1 million people to be able to begin their day that way, and have really had seen it as a privilege in this time as people need peace. They need connection to God's presence, especially as rhythms like physical church gatherings are closed for the time. I've really appreciated the opportunity of helping people get connected to God and themselves and have a perspective of what he's saying in this time. So Dad, here's what we'll do. We'll kick it to you. If you would, I'd really appreciate you get us up to speed with what's happened in the last week, as a lot of things have happened, and kind of give us a sense of insight of where this virus is going and maybe even what God's saying and doing in the midst of it.
Yeah, you bet. Well, one way to kind of get at this to start with is to look at it on 4 levels. And by the way, I would mention on the Denison Forum website, denisonforum.org, we have an updated paper. We talked about the paper last week and worked off of that a little bit. So this week we updated a lot of that. Some of it's the same because it hasn't changed, but a lot has. And so if you want to go to denisonforum.org, you'll see the website link at the very top, kind of the banner there. We also sent that link out earlier today as kind of a reminder of today's conference call. And so there may be some help inside that could guide our conversation, or hopefully could be helpful on the other side. So anyway, there's really kind of 4 pieces to this, 4 ways to look at this from a medical perspective. On the one side, the 0 risk comes when we have a vaccine. It comes when we have something that enables us not ever again to have to be afraid of this virus of SARS-CoV-2. The same way that we have a vaccine for polio, or we have a vaccine for smallpox. And at that point, some really amazing things have happened this week. There is a proposal that's being brought forward, a particular regimen that's coming out of Oxford University. You may have read about this. It's being tested right now in India. If it turns out to be as successful as early tests on rhesus monkeys were, then perhaps even by September, it might be possible to have an actual vaccine relative to this virus. Now that's at the earliest, and that's if everything goes exceedingly well. The reason they're able to do that is they're using pre-approved materials, pre-approved components to create this new vaccine. If you're creating a vaccine from scratch, it's 12 to 18 months. Because you have to make sure that this isn't dangerous. You have to make sure it's not harmful on all sorts of levels. But if you're using material that you already had approval for in different kind of purposes, you can combine that towards something. And that's what essentially they're doing right now. So on the vaccine level, that's a really positive step forward. We're also, this was today, we're starting to believe, researchers are starting to believe, that while the virus is mutating, as all viruses do, we don't think it's mutating in a way that would make a virus ineffective. One of the reasons you have to get a flu shot every year, whereas you only get 1 polio vaccine, is because the 4 different strains that make up what we call the flu mutate so much that on a good year, you might have 50% coverage from the time they've created the vaccine to when you take it, because it just mutates so rapidly. This virus is mutating as much as 30 ways, they think, but not in a way that would keep it from being susceptible to the vaccine. And so right now, anyway, early stage, really good news that it's not mutating in a way that would make a vaccine less effective. And there may be a vaccine coming faster than anyone thought might be possible. Now, even in the best case scenario, to get that to 7 billion people, is enormously challenging. They're saying there may be a few million doses in September in the best case scenario, and a lot could happen between here and there. The virus could mutate in ways that makes this much less relevant than it is right now. But anyway, relative to vaccine, the first piece, there's some really good news. On the second level, you're talking about regimens and therapies that don't vaccinate you from the virus, but help you with the symptoms. Now you're looking at what's called mitigating the virus, where you can make the acute respiratory syndrome that causes 50% of the deaths with this much less severe, or you could deal with other symptoms. And so you may have heard in the last 2 days about a thing called Remdesivir. It is a protocol that was already used in other applications that is early testing seeming to have some effect for those with advanced symptoms of this virus. Even Dr. Fauci today was saying this will be the protocol of choice for right now. And so now it's in no sense a game changer per se, but it does seem to be lessening mortalities to some degree, and it's shortening hospital stays by 31% of those that actually are at that stage 3 where they have to be hospitalized. And so there's some good news from a therapy perspective on this. On the third level is testing, to where we can get to the place where we know who actually has been infected, who actually has come on the other side of the infection, who the at-risk populations are. There's some good news there as well. You may have been hearing that we're not certain if once a person's recovered, they have any antibodies that keep them from getting reinfected. There's even been evidence out of South Korea of people that we thought were cured and then became sick again or became infected again, which would say that recovering doesn't give you antibodies and immunities relative to the future of the disease. Now we're discovering out of South Korea that that's not really the case. The people that we thought got reinfected really had dead RNA left over from the previous infection, but the tests are so sensitive they're picking that up, and we thought they'd been reinfected. And so good news that, again, it's very early, but at least it seems more plausible than it did, that once you recover from this, you have immunity at least for a while. For how long, we don't know. Against what mutations, we don't know, but at least there's some acquired immunity that testing can discover. And if you have that immunity, you could be more on the front lines in medical care or in other applications and that sort of thing. So that's a third piece, is the testing piece of this, and there's some good news. On the fourth stage, which is reopening the economy relative to social distancing, in Texas anyway, there's been some real significant news this week, as Governor Abbott has started a protocol that starting tomorrow allows some businesses to be more open depending on which they are, and whether, for instance, a restaurant could have a 25% capacity, as well as the drive-through. For churches, there are some guidelines that would say you could be present in an in-present service as long as you have open chairs on either side and an open row in front and an open row behind. That would be a way of doing social distancing, not requiring churches to do that. And in fact, a lot of churches are saying they're not going to do that. Even though they could do that, they're not going to, because they just don't think they're ready to do it yet. They're not ready to sanitize their spaces as effectively as they would need to. And if there are multiple services, to sanitize between services and all of that. So, but at least there's an openness on really 20 states right now that are looking at ways that they could start relaxing stay-at-home sort of restrictions and try to create a process toward a kind of restarting the economy. While we're waiting on the vaccine, we're waiting on therapies, and we're waiting on better testing. So those are kind of the four levels in which this seems to be operating right now. And that's kind of an update in recent days on what's happening on those four levels.
That's so great. So as a reminder for those that might have joined since we started this, there's a Q&A tool there at the bottom you can use. You can post a question under your name or anonymously, whichever you prefer. Also, just in case you're wondering, this is in a webinar style, and so other attendees can't see your video, we can't see your video. And so this is a really anonymous experience in case you were wondering. And Dad, thank you again for that update of bringing us up to speed. So much has happened the last week with opportunities for some of the economy to reopen, which is also bringing, I think, and rightfully so, a sense of fear among a lot of us. So what does that mean for us? What does it mean for our health and our safety? There's a number of questions in here that deal with a concept that maybe is where we begin a time of Q&A, which is this idea of where's the line in your mind, Dad, of where we should operate in the midst of new opportunities to have some new normals maybe coming out, if not this week, in the weeks that are to come. How do we prioritize maybe getting back to some new normal, maybe helping some improves with the economy, but also prioritizing not only our safety, but the safety of others?
It is such a sliding scale, and it's why it's such a complex issue. And what we're starting really is the issue to navigate here, isn't it? So let's do this on 3 levels. The first level would be the individual, the person. Want to be very clear about this. And again, I am certainly no doctor, although I work with doctors in the ethics position I have. But I want to be real clear about this. As I understand the state of affairs right now, we have not one proven therapy that will make you any more safe if you go out in public than was the case 3 months ago. Now we're closer than we've been before. And we've got therapies that are in testing right now that are exciting, and we've got vaccines that may come sooner. But right now, you are as at risk if you go out in public as you were a month ago, 2 months ago, 3 months ago. Even wearing masks do not protect you from others, it protects others from you. The point of wearing a mask is if you are infected, you might be less able to spread the infection if you're wearing a mask. But the virus is so tiny, it's 1/100th the size, the width of a human hair. And so unless you're wearing a medical mask, an N95 mask, the mask that you'd be wearing out, of the scarf or whatever, doesn't keep the virus from coming to you. It just keeps you from spreading it through coughing and sneezing and things like that. So just know as you choose to go out that today you are as unprotected from this virus as you were a month ago or 2 months ago. So just have that in mind as you're going forward. I know there's a pandemic fatigue right now as we're getting to spring and people are happier to get out and all those sorts of things. Just be very, very careful. Just be aware of that on a personal level. On a second level, if I'm thinking about this as a business, I'm thinking about this as a church, I'm thinking about this as an organization that very much wants to be able to start serving customers more effectively, wants to be able to start having in-home or in-person worship services more effectively. The first thing I just said applies to you as well. And so I was on 2 pastor calls this week, 2 pastor conferences. And what I had to say to them was, if I'm in a leadership role in any context, you have to ask yourself, what's the worst case and can I live with it? There is a greater than 0 risk in current context of somebody coming into your restaurant, someone coming into your office, somebody coming into your worship service, getting infected and dying. I don't know what that risk is, obviously. There are all sorts of sliding scales having to do with pre-existing conditions, mitigating factors, dose of a virus, all of that. But it's a greater than 0 risk. We have a chapel that I preach in on Sundays, and we're just deciding right now we're not going to reopen. We don't believe we have the ability to sanitize effectively, and we're just right now ready to run that risk of somebody coming in and becoming infected because they were there. Now, if you're going to stay at 0 risk until there's a vaccine, you're going to be closed at least till the fall and probably until next year. Even if the Oxford vaccine works and no mutation takes it away from that, it's going to be some time before we can manufacture billions of doses and all the stuff that's inside that. So I'm not saying stay home till it's 0 risk. I'm just saying calculate the risk, be aware of that to your employees as well as your customers, and do everything you can to be safe distancing even as you're doing this. Craig, part of what makes this so difficult for us is what we think about in these kinds of environments are things like, okay, in my restaurant, I can set up tables so that people are 6 feet apart. In our chapel, we can set up chairs so that we can do that. But your ingress, egress points are typically not set for that. In the chapel where I preach on Sunday, there's no way to stay 6 feet apart as you're coming in unless you're single file 6 feet apart. And you'd have to find a way to make that happen. If you're coming in and out of a church, coming in and out of a restaurant or an office or whatever, where I am right now, part of the reason I can be here on the 2nd floor of our office, there's only one other person on the entire office that's in their office. And we just stay ways away from each other. Every time I step out, I wash my hands when I come back. I just have to assume every person I see is infected. They have to assume the same with me. So on that second level, look for social distancing as best you can. On that third level, which is more the governmental side of this and public policy and all of that, one thing we have to be aware of is that COVID is not the only medical threat we're dealing with here. There's a great concern. Baylor's talking about this right now. There was an article put out by Harvard Medical School this week as well. We're not seeing the level of heart attacks, strokes, and other hospitalizations that we should be seeing right now. Now, we don't think it's because they're not happening. We're afraid people are unwilling to take them to the hospital. They're afraid of getting infected. They're afraid of not getting medical care. So we think part of the spike in deaths that we're seeing right now is not just COVID related. We're afraid there are people that are staying home and dying, people that are not getting treatment because of other things. So if we choose to lock down the economy because of COVID, there's going to be that effect relative to other medical conditions. There are cancer patients that are putting off all but the most urgent cancer treatments. And as a result, They may be dealing with advances in cancer that are going to happen because they're not getting into treatment, all of that. And then you think about mental health issues. I mean, a huge escalation in depression happening right now, escalation in anxieties, escalation in addictive behaviors. There is tragically an escalation happening with family safety issues and family abuse issues. And so it's nowhere near as simple as to say this is only about COVID. So really it's on all three levels. It's on the personal level to be safe, on the second level to provide safety for others, and then on that leadership level, it's how do we balance all of this together in a way that moves forward as effectively as possible.
What comes to mind for me as you're sharing is the need to balance researching and staying ahead of this, and Daddy do such a great job of providing up-to-date information so that we can process as a people where this thing is going, but balancing as well the role of the Holy Spirit in this, right. And that there is so many personal decisions that individuals need to make in this time, right. Especially as our politicians and government leaders reopen some opportunities for us. Then we have to choose what we bring ourselves into. We have to choose what we right. Have our organizations do in our businesses, and so I think that's maybe a prayer that we take away from this, mm-hmm. is a prayer for ourselves and others that we would practice wisdom and discernment, and we would seek to follow the leadership and direction of the Holy Spirit as he guides us day to day.
Absolutely true.
Gary Smith here asks a question. I think this is something I'm hearing a lot in people, is kind of a balance of the media in the midst of this, kind of looking back to the original announcements about steps we were going to take as a people in light of the virus. So specifically, Gary says, I understand the virus is real, but have our political leaders and media created an unwarranted hysteria? I really appreciate your ministry. Thank you for what you do. And thanks, Gary, for your encouragement. Maybe if you want to speak to that balance of political leaders and media, and kind of if there's any undertones or undercurrents of what's been happening in the midst of announcements and changes and things like that, just your perspective on that issue.
Yeah, you bet. It's really been in three phases. On the first phase, when this first started coming out of China, we had very sketchy information. We weren't clear as to whether early there were statements that wasn't even transmittable from human to human, was some of the first information that we were receiving. And then when it was decided that it was transmittable, the thinking was it was difficult to catch, difficult to transmit, contagious but not very contagious was the thinking, and the mortality rates were going to be very low. And so some of the early information that we got turned out very much not to be true. Now, there are all sorts of ways you can look into that, all kinds of ways you can draw conclusions as regards motives behind all of that. I don't have any expertise at that point, but that was the first phase. And so you could say that in the West, there was a significant kind of underplaying of this. The president's been accused of that. Boris Johnson's been accused of that. A lot of the Western leaders have been accused of not taking this seriously enough, of having weeks when we could have done more and didn't do enough. But at the time, we just did not know what we now know about this. Then there was a paper that was published by a group of researchers out of England that began doing some formatting of this, began doing some predicting, some modeling of this. They came forward to say, look, if we don't do stay at home, if we don't do quarantines, if we don't step into this, we could see millions of deaths, literally millions of deaths. At one point, there was, y'all may remember some of this, but there was a projection that as many as 200 million Americans could get infected, and millions of deaths that could occur as a result of all of this. And when some of that modeling came out is when you began to see a massive shift, not only in the United States, but overseas in various places. There have been some outliers. Sweden has not done nearly as much to shut down the economy as others have, and now they have a higher mortality rate than others do. But so anyway, there was a massive shift when some of this modeling came out. And that's when this question would come to play. The question would be, did we overreact? Did we shut down more than we needed to? Is this just the seasonal flu and we're overreacting to it and such as that? There's been some accusation of that perhaps we've gone too far in the midst of all of this. And so now we're at this third place where we're trying to mitigate risk versus reward. We don't want the cure to be worse than the cause. We don't want to create a great depression that's unnecessary. As we're kind of reacting to all of this. I think that third place, this balance, is the place that inevitably, had we known in January, we could have expected that we would probably get to. You can't really calculate mortality rate until you know infection rate. And in a disease where 25% of those that have it have no symptoms, and another 25% have flu-like symptoms, and you're in the midst of the flu season, it's impossible to measure actual deaths against actual infections. And so we really still don't know what the actual mortality rate of this is. We do know this, that the deaths that are attributed to COVID last month exceed the deaths attributed to the flu over a year. We do know that. We do know that right now, the best evidence we have is that this is far deadlier than the flu, far more transmittable than the flu, and creates far more lasting consequence even for survivors. We're discovering that this affects lungs in a way that can have permanent damage. For some, it affects the brain. You're hearing about people that are losing sense of smell and taste and their reactions to brain. For some, it's affecting them in vascular ways. We're finding heart damage sometimes as a result of this, and we don't know why. We don't know why men are dying more than women are. There's some thoughts that may have to do with blood type, may have to do with genetic preconditions. We just don't know that. We're so early in all of this. And so really, where are we? Did we overreact? Perhaps. But I love something Dr. Fauci said early on in this, and that was, he said, when this is all done, we want to be accused of having overreacted, because then we'll know we did enough. The only way you know you did enough is when you drive that curve down so much that it looks like you didn't have to do it. That's the only way ultimately we can know. At the end of the day, the reason they call it a novel coronavirus is we've never seen it before. It's in many ways unlike anything we've ever seen. I'm not aware myself, again, I am no physician, but I'm not aware in the research I've done of any disease for which 25% of those it infects have no symptoms and at the same time can be infectious. That's a tough thing to find. Now, I will say that 30% of people that have the flu don't have symptoms as you think of in symptoms, but it's not nearly as contagious as this is. So to be this contagious, to be this infectious and not know it is in some ways an uncharted deal. And that's why it's been tough. It really has been tough. So you could say we underreacted, then maybe perhaps we overreacted. I don't know. And so now we're at that place where we're trying to do some balancing. Tough deal.
Absolutely. Okay, so Tori Davis, Tori, thank you for your question, asks, with the state of Texas opening up in some venues tomorrow, I know that we're seeing, like, as you mentioned, Governor Abbott has allowed for some opening of our state. Mm-hmm. Not every state is opening in the exact same way, but I think the principle still applies whether you're in Texas or not, that in the coming weeks, I think the prediction is that more and more states will maybe be opening up some of their opportunities. So with the state of Texas opening up in some venues tomorrow, what's the medical perspective for those over 60 and their grandchildren? We haven't seen ours in 2 months. That makes me think about how many FaceTimes we've done with you and mom and our 2 boys. The children have been sheltered at home, out of daycare and school. Are we able to loosen those restrictions to see them again? I have both asthma and some heart disease, so I'm completely sheltered in the last 2 months. Thank you. I love how that speaks, Tori. Thanks again for your question. Maybe just some specific medical conditions, those with pre-existing conditions that puts them more at risk, and grandchildren and their children, which is resonates with us and things we've been talking about. So maybe if you want to speak to that issue for a little bit.
Yeah. My wife and I have a physical pain right now that we're not seeing Wes and Wells, that we're not getting to play with those guys. I cannot wait. I'll get teary-eyed. I can't wait for the next time that your oldest son takes me by the finger and leads me upstairs to go play, you know? I just can't wait to do that. And yeah, it's so hard. And it's getting springtime now and we want to get out more and, you know, on all sorts of levels. This is just such a tough thing. So let's start with the good news and then we'll kind of get to the bad news in this. There's some good news relative to where we are right now. Number one, there's some indication that the virus may be susceptible to increasing temperature and humidity. There's been some lab testing done that may give us that indication. We won't really know till we move forward, but that's possible. Certainly the case with the flu, that's the case. That leads to a second piece of good news. Part of the problem with this is that for many people, it manifests flu-like symptoms. And during flu season, how do you know which it is? Well, flu season is getting ready to end. As we move further into spring and into summer, we're going to get out of the flu season this summer. So if you have these symptoms, it's much more likely you have coronavirus, much more likely that we know that you have it, you know you have it, and we can treat it, we can quarantine you, we can get you away from your grandparents or your grandkids, and not just wonder, is this just a cold, is this just the flu? So moving into the season will make that easier as well, and will be a safer thing to do. And then, as we've already said, we're moving closer to therapies, we're moving closer someday to a vaccine, so there's some medical things on all of that. Now to the bad news. As of today, as we said earlier, there is no medical treatment for this that we know is going to work, that will either prevent or will mitigate symptoms. And those with pre-existing conditions are much more susceptible to this than is typically the case, depending on what the disease is. You've heard a lot about the 1918 Spanish flu epidemic. It disproportionately struck young people. Children and young adults died at much greater risk than older adults did. That was just one of the strange natures of that particular influenza. In this context, it's the opposite. Now, don't think what the early reports were, which were that if you're young, you have no risk here to speak of, and you had all these kids going, you know, on spring break to beaches and all of that. Children have gotten this. Children have died of this. It's no immunity. But percentage-wise, if you're over 80, this is frightening. The mortality rate for those over 80, at least in early stages, was at 20%. Now that's coming down some because we're learning ways to medicate. We're finding things we can do that are certainly turning out to be more mitigating treatments and such. But the older you got, especially once you got to 60, I'm 61, once you got to 60, you started seeing the mortality rate rising. We know the pre-existing conditions relative to diabetes, relative to obesity, to some degree relative to breathing issues, although not as much as we initially thought. Here's one I'll mention that's really frightening. In New York State, it was discovered after they did some long-term testing, 41% of COVID patients that had to be hospitalized turned out to have hypertension. That was the highest, by percentage degree, risk relative to pre-existing condition, 41%. 37% was obesity, 24% had to do with diabetes. Why do I say that's such a problem? 11 million Americans have hypertension and don't know it. It's what's called the silent killer. Until it's advanced, you can have high blood pressure, hypertension, and not be aware of it. So I say that to say, if you want to be paranoid, you could have the #1 pre-existing condition for this, at least in New York, and not know it. So all that to say, and I'm sorry to say this, if you're asking for just my opinion, and again, I'm not a physician, but just my opinion based on what I'm reading and what we're choosing to do, we are choosing to hang in there a little while longer. We're choosing simply not to take the chance right now. And again, it's not who your kids or your grandkids are. It's who have they been exposed to, or who have that person been exposed to, or who could we be exposing them to, and all of that. And so we're just continuing. Janet and I are just continuing right now. Now we're taking this on a week or two case-by-case basis, but we hate it. But we're just choosing right now for the next week or two to continue to do what we're doing right now. And then see where we are, see what we learn. We didn't know a week ago that an Oxford vaccine that could be available in September was that close. We just didn't know that. What will we know in a week? What will we know in 2 weeks? One other thing I'll mention, we're discovering that the virus is not nearly as transmittable outdoors as it is indoors, just as in an aerosol context, just because the wind's blowing around and all of that. And so as it gets to summer and it gets hotter and more humid, and it might be a windy day, Janet and I've thought about maybe getting over to your house and bringing hamburgers and sitting around in the backyard, you know, at 6 feet. But how do I not let Wes hop up in my lap? How do I not do that, you know? And so anyway, it's such a tough thing. My advice is to err on the side of caution, just because this for pre-existing conditions is such a dangerous thing.
That makes so much sense. I see my wife Rachel is watching with you with the kids. She posted here in the Q&A and it says, Wesley says, "Hi, Grandpa."
Hello, Wesley. Hi, buddy.
That's great. So there is a question here that I think also speaks to something that's maybe being uncovered in the last week or 2 weeks, as we've been undercurrent, is you're seeing at play kind of the balance of federal and state and local governments and what's even allowed or not allowed, or legal or not illegal, about some of the things that have been going on. I've seen a lot of questions about that flying around on social and other places. Sure. Specifically, an anonymous attendee says, "What should I do when my governor is giving different safety standards than my local mayor?" As you look to who do you listen to and what decisions and actions do you take in light of maybe some differences coming out from different government leaders and officials, how do you balance those things? Who are you listening to, and what would be your answer to that, attendee?
Yeah. No, it's a terrific question. It's on two levels. Well, one side's more the legal side of it, which we won't get into as much. I certainly would have no expertise there, but it just is the case, and we don't often think of it this way, that the federal government only has rights constitutionally, which are specifically delegated to it. All other undelegated rights go to the states. And depending on the state, quite typically those are delegated to the municipalities or to the county judges or to the mayors, or depending on what your system is, your city council or whatever it happens to be. The belief here is that governance is best done when it's most local. That's especially the case with this. Palo Pinto County, I saw on TV the other day, had 7 infections. as opposed to Parker County, which is to the east of it, which had 24. And then you get over to Tarrant and it's thousands, and you get over to Dallas and it's many more thousands. And so if I'm Governor Abbott and I'm trying to do something that is as relevant in Palo Pinto County with 7 infections as it is in Dallas over here, what I'm going to be doing is offering blanket guidelines and then trusting local municipalities and governors and county judges to do what's right and appropriate in that specific context. So if I'm a mayor of a town, first thing I have to ask is, what's our infection and what's our infection rate? Is it going up or is it going down? The federal guidelines would want it to go down for 14 straight days before you'd begin to opening up, just because there's a 14-day incubation period inside all this. I'd want to know, okay, I'm in Palo Pinto County, pick on them, and there's only 7 infections. But if we do this event this weekend, will a lot of people drive in from Dallas? And now our infection rate's going to go up because it's coming from people that have a much higher infection rate than is the case here. I have to ask myself about demographics, elderly versus younger. This is a horrible, tragic fact, but African Americans seem to be more susceptible relative to more serious response to this virus than is the case for Caucasians. We don't know why that is the case. We have no idea what that is. There's some suggestions or some issues inside that, but we don't really know that. So I'd have to think about demographics relative to that. All that to say, a governor, especially in a large state, really can't issue guidelines that are specifically perfectly relevant to every municipality. So locally, I'm going to be looking to local leaders as they're interpreting what the governor says relative to my local context. I think what the governor in Texas did was allow permission from a statewide perspective, with the understanding that you will then act on that as you will. He in no sense is requiring restaurants to open to 25% capacity. He's in no sense requiring churches to start in-person services. He's saying if it makes sense to you in your setting, the state gives you permission, as it were, to do that. And then you have to make that decision in the local. Tip O'Neill said years ago, all politics are local. In this context, that's especially true, I would say.
An anonymous attendee asked a question that right here at the bottom says, sorry, this is premature. This is such great information. I'd like to see it again with my wife. Will it be available for replay? And thanks so much for all you do. We are recording the call. We will absolutely send out an email. This email that you received with the link, you'll get another email from us that details how you can get access to the recorded version of this to watch it whenever is helpful for you. There are some questions in here that, or one question specifically that relates to maybe a broader perspective as we look at maybe kind of the worldwide landscape, geopolitical landscapes. Specifically asking for, Mark asks, what are the updates from China and Italy? Maybe if you want to speak to, I know this is started in so many different places. I was privileged to be on a call with a number of international leaders a couple weeks ago. I think it was about 480 people. My time was like 5 in the morning and I popped on. It was honestly a really cool experience to be on Zoom with about 480 people. And the host was asking for updates. There was a man that lives in Madrid that was giving updates, which has seen especially hard times. A friend of mine that does ministry in Hong Kong, who's obviously had incredible challenges with him and his family and his church and the evangelism ministry that they do there. And so if you want to speak to just kind of give us an update of how you see this and the effects of it globally, specifically referencing maybe China and Italy.
No, yeah, great questions. On the China piece, we don't know, is the bottom line. And I don't mean this to be unkind, it's just a fact. If I were a Chinese communist official on this call, I would be saying this to you. And that is that the press is controlled by the party. It is controlled by the one-party system there. And so it's just impossible for us really to know. What we're being told is that Wuhan, which is really where all of this started, we think, is getting more back to normal now than ever before, that they're starting to open up their economy at new levels. They're claiming not to have new infections. They're claiming to not be completely done with this, but they feel like that they're toward the end of the curve on this. Italy is certainly in a better place than they were a few weeks ago. They were especially victimized because they have the oldest population in Europe and had some of the highest density population as well, which made it extremely difficult to stay at home easily. If you've been to Italy, you know that it's an outdoors culture. People don't live in their homes. They essentially sleep in their homes, or their flats, as they would say, but they typically eat out in cafes and they're out all the time. And that's just the nature of the culture. It's a very communal culture. It's a multi-generational culture where you're more likely to see at-risk older people that are very close in proximity to children and grandchildren, even great-grandchildren. So there were some real cultural issues that you were dealing with in Italy that you wouldn't see in rural West Texas necessarily. But they're certainly on the other side of it now. And for that, we're grateful from an infection perspective. New Zealand is claiming not to have any new infections, at least in recent days, and feels that they're in really good shape here. Sweden, that chose not to do some of the same lockdowns others have, has seen a higher level of infection and mortality on the other side. But again, when you're asking higher, it's relative to a much, much smaller population base than is the case here in the United States, of course, or would be the case in China or whatever. And so really you're going to see this happen based on what the demographics are, based on how governments have responded to this. I would say Germany's getting kudos for the way in which they've responded to this, for how proactive they were, how quickly they were able to do some distancing, some stay-at-home things. They also typically have a younger demographic, have a younger and a very healthy demographic in terms of just it has to do with culture, it has to do with exercise and diet and all of that. It tends to have a less susceptible population to some of this as well. So yeah, it's really a smorgasbord, isn't it? There's no one response that you say Europe is this or Asia is this or South America is necessarily this. And that's going to continue to be the case until we get a polio-like vaccine that every person can take that permanently immunizes us to this, where this is going to be part of the conversation. And then to add one other piece to this, coronaviruses are going to be in our future. They are a part of nature. This is how viruses work and mutate because we're so geopolitically connected now. It's just so much easier to spread these things than ever before. That there are some predictions that every 20 years, we're going to see a pattern like this as a predictable thing. Good news is we're better at responding than ever before. We can learn from every one how to respond to the next one, perhaps. And so I'm not predicting we'll see this kind of devastation economically and health-wise every 20 years. But this kind of thing is really something we can expect. And I'd add this as well. In my generation, at 61 years of age, this seems new to me. For my parents, it wasn't. My parents could talk about what it was like to live with polio. They could tell you about what it was like to live with smallpox. Their parents could certainly tell you what it was like to live with cholera and with smallpox. And these kind of pandemics are really part of the human condition. We're in our 7th cholera pandemic right now. We just don't see it here. Malaria is in many ways the most dangerous pandemic in the world. It's just we don't have to deal with it much in the United States. And so this idea of dealing with constant health threats is certainly something we're feeling like is brand new to the human condition, but in no sense is that really the case.
That's okay. To get practical for just a second, this is something personal to Rachel and me around food. So we were talking last night as we were cooking dinner again and realizing like we just miss being able to go out to restaurants. We miss being able to act, and we're tired of doing cooking and cleaning and just how many meals are cooked at home now. Our dishwasher feels like it's constantly running. And so there's a couple of questions in here about food preparation, safety standards around food preparation. Kay specifically, and Kay, thank you for your question, says, is restaurant food safe if it's been prepared by an infected person? How do you think about that? And any even steps that you're taking as far as getting food from restaurants and things like that right now?
That's a great question. And again, I'm not a medical doctor, but I've been watching the research pretty carefully on this. Well, I'm not aware of any evidence that this virus can be transmitted through diet in the sense that you can ingest it and catch it. So even worst case, you always have to think worst case scenario, someone's preparing, I don't know, these fajitas that you're picking up to take home, and they coughed on them before they wrap them up, and they have the virus. And now the virus is on these fajitas. The threat, as I'm aware of it, is not that you'll ingest that and catch the virus through your gastrointestinal system. Doesn't seem to be the case. The virus doesn't seem to be able to withstand that process. That would seem to kill the virus if that's the case. The threat of this is surface contamination. It's the same threat as if someone coughed on a desk that you touched, someone coughed on a rail that you touched, and then you touch it, and then you touch your face. It's the surface contamination issue that is really in play here, whether it's food that you pick up or the containers or the person that hands it to you and all of that. I will tell you that apparently the virus is not able to survive on porous materials like cardboard and paper nearly as well as it can on flat surfaces, on on a table that you would sit at if you went into a restaurant, on the counter that you set your food on when you bring it home and you put it on the island or the counter, something like that. Flat surfaces, unless it's copper. Copper kills it in 4 hours. But other than that, oddly enough. And so this is what we're doing. When we're bringing food home, when we drive to a restaurant and we pick it up and we bring it home, the first thing we do is when we bring it in, we wipe down all of the external surfaces. If it's something that's in a plastic container, we get Clorox, we have Clorox wipes. We wipe down the external of that, okay, to make sure that we're not going to pick something up from that ourselves. Then we wipe down the surfaces we put it on. Then we go wash our hands, as you're supposed to wash your hands for the 20 seconds and all of that. And then once we sanitize the surfaces relative to touching ourselves, we're not worried about the food itself. Now, if you're going to put the food in a refrigerator for 2 or 3 days, less likely that the virus is going to survive that, even on the external container. But think about food not in terms of what you'll ingest, but in terms of what you'll touch, because that's how you could get this virus from that. Now, the food provider could contaminate you from an aerosol perspective. And there was some research out even today out of China indicating that the virus may live in the air longer than we thought it did. And it's possible you could walk through that space, that air, and ingest the virus. We don't yet know if that's the case, although that's a possibility. And so I'm going to maintain at least 6 feet distance from the person handing the food to me if I can. If I can't do that because it's a drive-through, I'm going to be as far away as I can. I'm going to wear gloves. Now, parenthetically, if you're wearing gloves, be very, very careful not to touch your face with the glove, because the virus is just as likely to be on your glove as it is on your hands. The reason you're wearing the gloves is so you can go home, discard the gloves, wash your hands, and not touch your faces till you've done all that. But it makes it less likely that you get that on your hands and on your clothes and all of that. So yeah, it's just really a difficult thing. It's safe to eat, it just may not be safe to touch.
So great, thank you, Dad. So as we maybe transition out of some of these practical questions, as well as questions about government, geopolitical things, ramifications of this, maybe we transition into talking about some of the spiritual ramifications of this as we kind of ramp up to a close in the next 15 minutes. There's a couple of questions that relate to that. One that I think is a question that's worth addressing every time we do one of these, especially as we change times and do different things like that with different audiences. So it's something you spoke to last week, but I think is absolutely worth speaking to again. Gary, thank you for your question. Says, how should I respond to someone who says this is God's judgment on us? He says, I think I know your answer, but I want you to share your thoughts. That's a question I continue to hear popping up. And as I do interviews with other individuals, it's something that gets asked often. I think it's really something that we need to hone in on as God's people, and even be prepared to not only understand ourselves, but actually be prepared to communicate, not only in these days, but as we move out of this virus and have gatherings opened back up and church services. And I think as hopefully there comes a day where we get back to some semblance of normal and people start asking the bigger questions around what does this mean for whether God's good and if he's real, and all these things we see in the pages of scripture, whether they're pandemics or they're plagues or things like that. So if you want to speak to that idea of this being God's judgment on us, I think that's a really helpful thing to speak to.
Yeah, terrific. Yeah, Craig. And it's on 2 levels, Craig. The first level is on the merits of the question itself, and the second is the larger question behind the question, you know? So let's go to the second one first. If I'm asking, is God judging us with this? I'm presuming that he's the kind of judge of God that would do that. Even if he's not in this particular instance, he may be the kind of God that would do that would judge us through a pandemic like this. Because in scripture, you see him judging the Egyptians through the plagues. In the book of Revelation, you see judgment on sin, that sort of thing. And so really the answer to the first is the answer to the second as well. In the first, the reason I'm so convinced this is not a specific judgment from God is in scripture. First of all, when God uses things like disease, they're always supernatural in nature. The plagues were supernatural. The physical malady that came upon Herod in Acts chapter 12 was supernatural. What happened with Miriam was supernatural. It wasn't a natural thing that just kind of evolved in this way. It was supernatural. And second, it's God's judgment against specific sins and specific sinners. I'm not aware of any specific sin that caused this. I'm not aware that this is lung cancer from smoking or cirrhosis from drinking or something that you have a behavioral background for, something specific to that. And so I don't think this passes either of the biblical standards relative to specific judgment. But that leads to the larger issue. God doesn't want to judge. God is a father. God loves us. 1 John 4:8 says God is love. Not just that he loves, his whole nature is love. In John 17:23, we learn this astounding fact that I really first thought about when you wrote about this on First 15 some years ago, that the Father loves us as much as he loves his son, his own son. Not because we deserve that, of course, but because he is love. He can't help it, if you want to put it that way. He is love. And so the old saying is, God deals with us as gently as he can or as harshly as he must. God brings judgment only when he must. And the purpose of judgment is to lead to repentance. The purpose of judgment isn't that God's mad at us. It's not that God's taking out his temper on us or his anger on us, or God has just decided that we deserve this or something like that. A good parent would only punish the child as a means to the end of reforming the behavior of the child. A good parent wouldn't take out their temper on the child or get angry just for the sake of being angry. They would only punish because they had to, and only do it to bring the child to the kind of behavior the child needs to have. It's what my dad used to say, this hurts me more than it hurts you. And I didn't believe him until I had kids, you know? And so, no, he is not the kind of God that would even do that, that would bring an indiscriminate, horrific disease that would attack elderly and young, attack across all demographics for no apparent kind of sinful cause. Not only did he not do this from a biblical perspective, that's not consistent with his character. That's not who he is. When he judges, it's because he has to, and only to bring people to repentance. And he's waiting on that. That's why in 2 Peter it says, God is not willing that any should perish, but all should come to repentance. That's the kind of God he is.
And so I'm reminded as you're sharing your thoughts on that, of moments in my own life when I've had times of suffering or grief, or times that have been especially challenging, and moments even where I was angry with God for those things. Sure. And God, why would you lead me to those places, to this place of suffering or grief? And specifically in one instance, I remember I was so mad. It was a few weeks. The rhythm of spending time alone with God has carried me through so many parts of my life, so many changes and transitions and good times and hard times. And so in this specific instance, it was weeks before I got alone with God again. I was just so angry. And he was even still leading worship at the time and doing these different things, but I couldn't get alone with God. That felt too close. So I could lead worship on a stage, but I couldn't get alone with him the morning after. And I finally just missed him, I think. And so I just couldn't take it anymore. And so I remember I got alone with him. I got my guitar out and I was just kind of processing my emotions and thoughts. And I remember I walked away from the instance not feeling like I knew I had more answers as to why this situation arose, but I did know that God was present with me in the midst of them. And what came to mind is passages that say that Jesus is a man of sorrows even, and that he's well acquainted with grief. He himself experienced exhaustion. He himself, obviously with his death on a cross, experienced physical trials. He had experienced the loss of friends and the pain that comes along with that. There's so many in that God, part of the gospel that I think maybe we don't talk about often enough is that a lot of the promises that God gives us is not related to the resolution of our circumstances, but the ways he meets us in the midst of them. And so I think there's power for us to be able to understand that, maybe first for ourselves in light of this pandemic, but also maybe get clear on how we communicate those things to people as they ask those questions in earnest as we come out of this virus, hopefully in the weeks and months that are to come.
Yeah. And some of that will be how we process it ourselves, you know? It's one thing for me to impress you with my faith when all is well, but when I'm suffering and still trusting, you know, that's when you're impacting people you may not even know you're impacting. A quick story that I'll never forget, I came across this years ago, was about a family that lost 2 children during an influenza epidemic one winter. The next season, Easter came early. Their first time back to church was Easter Sunday. They're singing the hymns. They're celebrating the resurrection. This family, in the midst of this horrific grief, a little boy was walking out of church and he said to his dad, pointing at the family, said, "They really believe it, don't they?" And the father said, "Believe what?" And the little boy said, "Easter. They really believe it." Well, I don't know if that family would ever know the rest of their lives, the impression they made on that little boy by the fact that they were worshiping a risen Christ in the midst of their own grief. It's at a time like this, not only that people are more open to the gospel and gives us an enormous opportunity to share our faith and our love in just incredible, in many ways, unprecedented ways, but it's also our opportunity to demonstrate the reality of our faith.
That's so good. Okay, maybe we'll make time for one more question. I do want to say, just out in response to what you said, that we know that a lot of people are suffering right now in a lot of different areas. And so I hope that you guys hear that as encouragement. There's so much opportunity in the midst of this, and know that we are here for you. If you're specifically in one of those places, we want to be able to be available to you, either to pray for or with you, to provide resources to you, especially as those that have financially partnered with us want to be available and know that you're here. We're here for you. And so if you're in that place where maybe you've lost a loved one, or you're experiencing a loss of a business, if you're experiencing the loss of health in some way, or especially dealing with anxiety or fear in this season, we are here for you. And so you can contact us in a couple different ways. One is you can reach out at contact@denisonministries.org, contact@denisonministries.org. There's also our phone number. It's 214-705-3710. Feel free to reach out to us anytime. I would be happy to pray for with you and give you whatever you need. There is one more question we'll get to, and then we'll wrap up our time together. Thanks again, Dad, for making yourself available to kind of guide us in the midst of this and give us insight. One question I've been hearing especially a lot that I think is something that's affecting everyone, even if they not experiencing a loss of health or business, or they don't have a close loved one or friend that's been diagnosed with this. This anonymous attendee says, I'm reminded of even the birds of the field have a home, but still struggle with anxiety during this time. What might a biblical perspective on anxiety look like during crisis? And I know for me, it was weird the times that I've had to go into grocery stores and, now wearing a mask and doing these different things. It just is, my heart beats faster. And I find myself, even though I know I have to breathe, it's like I'm breathing less frequently when I'm in those scenarios, because I know the ways in which the virus is transmitted. And so it's almost subconscious that I'm doing these things. That doesn't help, but it even makes me feel more anxious. And so I know that's something we all are struggling with a lot. And that's something that God promises, his provision of peace, not with a resolution of circumstances, but in the midst of them. Maybe if you want to kind of offer some perspective on a biblical perspective on anxiety for us.
Yeah, thank you. And the first thing I would do would be to say what Scripture would say, which is how real this is. We're fallen people living in a broken world. We wouldn't have this conversation in the Garden of Eden, but this is especially the case for us. Now, I'm so tired of this. We're all so tired of this. There's such a pandemic fatigue that we're all feeling right now. It's like it's the background noise all the time. It's there when you go to bed. It's there when you wake up. I mean, how could it not be? Hasn't been anything in my lifetime that has affected us this holistically. Even if you went back to World War II, unless you're a soldier on the actual battlefield, you're actually serving overseas. You've got a child there and you're thinking about this all the time, a son probably serving there. And obviously your life's affected by this, but you're not personally at risk. You're not thinking Hitler or the Japanese are going to attack you in Dallas, You're not going into the stores and being afraid of death or something like that. It's not on this level. This is a level of anxiety that is, in my lifetime, unprecedented. And so the first thing to do would be to say, this is the way it works in this fallen world, that we can know this, we can admit this to be a reality. Jesus on the cross cried, my God, why have you forsaken me? These kinds of questions, these kind of issues, this kind of anxiety, first thing to do is to name it. Second thing to do biblically is to be very specific in trusting it to God. It's not generic so much as it's saying, Lord, I'm asking you to help me with this. I'm feeling anxious about my grandmother and her pre-existing condition. I'm really worried about my business because I'm not sure we'll be able to make it another month like this. Lord, I'm very concerned about tuition for my kids because I hadn't saved enough really for this. I've got a son that's graduating and doesn't know if he should take a gap year or not. And I'm really needing your wisdom, but you can't be too specific about this. And then as you're giving it to God, according to Matthew 7, the Greek says, ask and keep on asking. When Jesus says, ask and it'll be given to you, seek and you will find, knock and the door will be open. It's a present tense imperative. Ask and keep on asking, seek and keep on seeking, knock and keep on knocking. And the reason you're doing that is not because you're informing God. In fact, in Matthew 6, Jesus says, your Father knows what you need before you ask him. When you're praying, you're positioning yourself to receive what God's grace wants to give. You had to be in a certain position to be part of this conversation today. I had to be in front of my laptop to have this conversation. Doesn't mean you earn it. You have to be in position to receive it. And so the thing to do is to name the fear, name the anxiety, name the concern, and keep giving it to God. Every time it comes back, name it again. If you have to pray about it 80 times today, that's great with God. If you have to, every time the fear comes back, every time the anxiety, be a specific, try to unpack this stuff. Counselors say that anxieties grow on each other till you're under this gray black cloud and it just is bigger than you can imagine and the sum's greater than the parts. Take that apart. Even get a piece of paper out and say, why am I feeling anxious today? And be very specific. It's because of this and this and this. And then name those and give those to God very specifically. And when they come back, keep giving it back to God. And then the last piece of that, as you're trusting God with this, and knowing that he redeems, is to what you said a minute ago, Craig. Know that a lot of how God's going to redeem this is not so much by what he says, but by what he does in you. There will be a peace that passes understanding that guards your heart and mind in Christ Jesus. There will be a sense of his presence with you. As you hurt, he hurts. As you suffer, he suffers. When you walk through the valley of the shadow of death, you need fear no evil, for I am with you. The Lord says, my rod, my staff will comfort you. You're going to experience God through this in a way that will transcend this, in a way that will be with you on the other side of this. So it's expected. Of course you're anxious. How could you not be? We all are. All of us are. How could we not be anxious? Expect it. Nothing wrong with you that this happens. You're living in a broken world, and this is just the way the world works. Expect it, name it specifically, and give it to God, and then ask God to work in your heart, work in your life. Ask God to mold you and shape you and make himself real to you in the midst of this. You'll experience God now in a way you couldn't have experienced otherwise. And that's one of the ways God will redeem this.
Dad, thanks so much for that. That's where we'll end our call for today. We'll end it with prayer in just a moment. Before I close this in just a second of prayer, I want to thank everyone again for being here. Thank you all for your questions, for those that we were able to get to and those that we weren't able to get to today. Know again that we are here for you in this season. So feel free to reach out to us at any time. And we could not be more grateful to be able to partner with you in this season and the ability to be able to resource literally millions of people around the world, to be able to understand God, understand the world around them, be able to connect to God and themselves and be able to love others, and ultimately be able to empower people to be able to mobilize the kingdom inside of their sphere of influence. And so thank you for partnering with us for such a time as this. Let me pray for us, and then we'll end the call for tonight. Lord Jesus, we do thank you that your presence is with us, even here, even now. There's so much need, even with those of us that are here around this virtual table tonight. There is so much need in our own lives. There's so much need in the world around us. And Lord, we know that you see that need even more than we do. You see every facet of it, everything that's caused it. And Lord, that you have plans to redeem all of this in which you've allowed. And so, Lord, we pray first for ourselves. Would you speak to us? Would you guide us? Would you meet us in power with your presence? Would you illuminate your scriptures to us as we open your word? And God, would you empower us to be able to pray with faith that this virus would come to a close? We pray for those that are suffering, even especially in the season, whether they're experiencing loss of business or loss of health or loss of loved ones. This virus has affected in maybe the most ways those that were already the most vulnerable among us. And so we do pray, God, for comfort. We do pray for healing. We do pray for redemption. We do pray for a movement of your spirit across this earth. And ultimately, Lord Jesus, as we look worldwide and the effects of this, we do pray and ask, God, that you would bring this pandemic to a close. We do pray that you would bring inspiration to those that are working day and night to bring what they need in order to, in the way of vaccinations, in the way of medicines that can mitigate the symptoms. We do pray, God, that you would move in inspiration and power to be able to give us as your people what we need in order to be able to bring this pandemic truly to a close. And Lord, that at the end of all of this, we would see the ways in which you moved so clearly, see the ways in which you were faithful in your provision and your peace and your presence and your power and revelation and wisdom and insight and discernment. We would see you high and lifted up, Jesus, even in the midst of all of these things happening as symptoms of brokenness. And Lord God, that we, your people, would lift you up in the midst of these times, and that ultimately in some form, in some way, that the effects of this virus would ultimately would glorify you in some way, Lord Jesus, for the sake of your glory and our good, we pray. In your name, Jesus, amen. Thank you again all for being here. Let us know if you have any future questions, if we can help you in any way. And thanks again for all the ways in which you've empowered us to be able to make an impact for such a time as this. And Dad, thanks again for doing all the work that you do tirelessly day in and day out to be able to stay ahead of where this is going and then lend insight to us that are constantly asking you questions. We appreciate that. Have a good night, everyone. Thank you.